everyone, welcome back to No Place Like Home. And today I'm going to do something different. I'm going to talk to the men and the ladies about what a mammogram is. And I'm going to answer some questions that y'all may be fearful of or whatever. I am a mammographic technologist, and I have been doing this for almost 15 to 16 years. I started out as an x-ray tech, and I did that for about 20 years. So then I had a passion to do mammograms. And so I'm here to just answer questions. First question, what is a mammogram? A mammogram is an x-ray that the doctors can look inside the body to detect any abnormality inside the breast. It is used as a tool for screening and diagnostic mammogram. Next question is, are the mammogram painful? Yes, to some ladies it is. Everybody experiences some type of pain. I don't like to say pain, I like to say discomfort, because you tell a lady it's going to be painful, they're not going to come and have their mammogram. So a lot of ladies, when they come in the room, they ask me, now, the last time I had this done, it was very painful. And I tell them, I said, well, this time what I'm going to do, you let me know when it gets painful, and then we'll do something different. Okay, the next question is, what can mammogram detect? Mammogram can detect any abnormality, calcification, or cyst that's in the breast. What age should a woman get a mammogram? Good question. At 40 years old, you should have had your first mammogram. What to expect for your first mammogram? Okay. You will be asked about your medical history, because that's very, very important. Because we want to know anyone close to you that have had breast cancer. If it be your mother or your sister or your daughter, any of those three peoples that has had breast cancer, that's something we need to know. Because why? Because you are high risk for breast cancer. What can I expect doing my mammogram? Okay, so once we get you in the room, we're gonna do 4 pictures on you. We compress. We gotta compress. That's just part of it. You got to be compressed. But if it gets too much for you, I always tell my patient, if it gets too much, let me know. I mean, compression is good, because we got to compress. We compress, that means that we're spreading those tissues out so the radiologist can see all around that breast. But if it gets too much for you, you let the tech know, say, hey, this is hurting. And then she'll come in there and maybe put it up just a little bit, turn the little knob just a little bit up, so it won't be compressed as much. But try your best to hold that compression, that technology. Because why even come in if you're not going to let her compress? I have had ladies come in, I just touch them, and they, oh, that hurt. Well, it's going to hurt. That's a mammogram. But if it gets so that we don't want to have it so compressed that it's gonna be really, really painful, we not in there to hurt. Some patients think we in there to hurt. We really aren't trying to hurt you. We try to help you, and we want good pictures so the doctor can look at it, and then he can see if anything wrong. That's all. That's our job, to have good pictures for the radiologists. Okay, next question. What if I have implants? Okay, good question. A lot of ladies come in with implants. So we still gonna do your mammogram. We do 8 pictures. We do 4 pictures over the implant. We don't compress them. We just put the machine over it and then just take a picture. Then after which we do what we call pushbacks. So we're gonna pull that implant back, because at this point in time we only want the tissue. So we're going to move that breast back, and just press right there over just where the tissue is. What if I have a lump? Okay, so the radiologist is going to read your mammogram, and a lot of ladies like to ask, well, can they read them now? No, we can't read your mammogram now, because sometimes we have to get pictures from elsewhere. And that's another thing. If you had a mammogram done somewhere else, please go ahead and get a CD and bring it. So when you come in, you'll have that CD, and then the technology, it'll be so easy on the technology and the doctor, because they can read your mammogram that day. But if we have to wait to get your pictures, it's gonna take a little longer, because some hospitals just don't send them right off and send them right back. So either you bring your CD with you, or you have to wait. And anticipation is a long time to find out if you have breast cancer or not. So bring your CD with you. And I'm trying to see if that's all the things that I need to talk about. And if you do have a lump, that's what I was going to talk to you about. What the radiology does, they read them, and then they send your doctor report, and then they're going to send you a report. And they're going to say, we need some addition pictures. Will you please come back in so we can have that done? And when you come back in, we'll do like maybe 2 pictures. It depends on what type of lump it is and where it's located and all that. But most time we just do like 2 pictures, unless the radiologist wants something else, and we'll go ahead and do something else. And then if you have to come back for those, and if you do have to come back for those extra pictures, please come back. Don't say, I ain't coming back out there no more because they hurted me. No, come back, because if this is going to save your life, please come back and have it done. I have had to come back, and I'm a technologist, and I had to come back for some, and it's kind of stressful a little bit, but they are so high tech now that they can just get you in there in what they call the sterile tacket, and you can go up in there and they'll get a little piece of tissue, and they'll send it to the lab, and then if it is breast cancer, then they'll call you back again for surgery, and your doctor will do that. The radiology, they won't do that. Your doctor will call you and let you know that they found this and it is cancer, and we need to set you up for surgery. So yeah, so that's all I have to say. I'm trying to think of anything else that we need to bring out. Also, when you come in to have your diagnostic mammogram, if they call you back, they will go ahead and do an ultrasound also, because an ultrasound can tell whether it's a cyst or it's something real. Because if a cyst is not as bad as if it was a real cancer. So we will do 2 pictures on you for diagnostic, and then we'll send you over to ultrasound. They'll do the ultrasound on you. And I think that is all. And if y'all have any questions about mammogram, just put it in the comment, and I'll try my best to answer. And I have everything pink here. I had my mammogram done the other day, and I got this little pretty little cup because this is Breast Cancer Awareness Month. And they always going to try to give you something on breast cancer awareness in October. So try to go and have it done if you're not already. And this is one of the previous cup that I got. I'm not going to show the facility that I have done it at. And I got my little pretty rose. And I've gotten all kind of stuff. We got bags, all kind of stuff in October that they give out for breast cancer awareness. And I just wanted to talk to y'all about that because it's very important, ladies. Even men's, I want to talk to y'all too. Sometimes men don't understand what women's go through when they go have a mammogram, but I have did men's too. And it's only 1% at this point in time men that have breast cancer, but men do have breast cancer also. So if you feel a lump, means don't be my show. Go in and see the doctor and tell the doctor that, hey, look, I feel this. Because sometimes it be like some kind of medication y'all taking or something that can be caused your breast be lumpy. But go in and see your doctor and tell your doctor that, let your doctor know that, hey, I feel this. And y'all, most men is kind of shy when they come in and have them done, but we make them real comfortable. And I want to give a big shout out to DIY Design by CCW Tablescape, Design in Pink. And I said, wow, I am a technologist. And she had to bring it up. So I thank you for that design, DIY design. Y'all go to her channel and watch that pink design that she have on her table. I think that was awesome. And so she really inspired me for doing this today. And I want to thank her for that. And so I got my table all in pink. And this is my t-shirt that I wore at one of the facilities that I worked it at. It's the Power of Pink. I think this is so pretty. And so thanks again for all my subscribers and all of my new subscribers. I thank y'all. I thank y'all for this, for letting me come in y'all home and to do this video here. And I hope I have inspired you ladies and men. I hope I have inspired y'all to have your mammogram done. If you feel something, and if you don't feel anything, ladies, at the age of 40, you should already have started your mammogram. And even in your 20s, if you feel a lump, go see your doctor. And ladies, if y'all feel a lump at over 40, don't wait. I mean, I've had ladies that waited, and by the time they got to us, it was too late. And when I see that big mass on your mammogram, it's not a good feeling. And so it's not a good feeling. It's not. So have your mammogram done, and we'll see y'all the next time. And I thank all my subscribers, and I thank all my ladies that's watched me. I wish I can translate it into another, because I have different ladies from different countries watching me. And I just hate that I don't know how to do that. But if I ever find out how to do it, if someone know how to do it, they put it in translation for others to see it, let me know. Put it in a comment and let me know how to do it, and I'll do it. And thanks again. Y'all have a blessed day and a safe day. And may God bless y'all, and have your mammogram done. And have a blessed day. Bye-bye.